Hi, this is Danielle Bylund, the External Communications Manager for the Northside Achievement Zone. And today I'm talking with Tom Steinmetz, the CEO of Washburn Center for Children. We're going to be talking today about what Washburn is doing to transition to telehealth and how they're serving the community. Thank you for meeting with me today, Tom. I would just like to start by asking you what a brief overview of Washburn's scope of work is during this time with the coronavirus and all of the communities that you serve under stay-at-home order.
Yeah, so we, Washburn Center for Children, everything we do is all about children's mental health services and training. And each year we provide assessment and therapeutic services for just under 4,000 children and their 12,000 family members every year. So when the schools were closed and when the stay-at-home order was issued, we had to really rapidly transition everything we do from what had been almost entirely face-to-face therapeutic services with children and families to being completely done through telehealth. So on March 17th, we transitioned nearly all of our staff to do remote work. And then on Thursday of that week, the 19th or whatever that was, we basically rolled out and built up telehealth capacity across all of our 160 plus therapists so that every one of them could both connect with all of the children and families that they were already supporting and working with virtually, but also be equipped and set up to be able to start providing new services for children and families that were reaching out and seeking care during the coronavirus.
Great. So can you just tell me a little bit about the transition of the process of the transitioning entirely to teletherapy? How did that go for you guys, and what resources did you use, and how that's being streamlined?
Yeah, overall, it went amazingly well and amazingly smooth, given how huge of a transition it was. And we also know there were some bumps and adjustments along the way, both for kids and families, but also for our therapists using the new technology. We were really lucky in that a huge percentage of what we do already is school and home and community-based. And nearly all of our therapists were already set up with tablets and laptops. So they were really positioned to do that. And we had the technology infrastructure to roll that out. So the big shift for us was providing specific training for our therapists in how to do virtual therapy. And then we worked with a HIPAA compliant, a private and secure platform to provide all those services. And then we also had to follow up and communicate to children and families how accessing services through telehealth was going to be different from either them coming in to see us or us going out to their home or their school to meet with them.
Excellent. Can you just tell me what kind of common challenges you're seeing in the community that you serve? What kind of themes are arising from some of the services you're providing?
Yeah, so the most common challenges and stressors that we see with the children and families who come to Washburn Center, the single most common challenge is anxiety. We also see and work with a lot of childhood depression, and then times where the families might be struggling and going through a difficult transition related to grief and loss or a divorce or transition like that, some kind of family conflict. And then the fourth situation would really be where the child has experienced either a traumatic event or a series of traumatic events. So we work with a lot of children and families who've experienced some kind of trauma in their life that they're still working and healing with. And since the onset of the trauma, I think, or of the coronavirus, the two big changes that we're seeing is obviously families are much, much more isolated right now. And so the added challenges of not being able to see and connect with your friends, your teachers, your families, all of that is happening. And then there's this pervasive feeling of anxiety that I think nearly all of us are feeling with the both the impact the virus has already had and then the uncertainty with it and not knowing what's really going to happen. How are each of our families, our friends, our neighbors, our communities, how are we going to be impacted by this? And we see that just increasing the overall level of anxiety that nearly everyone is feeling right now.
Just in terms of how families can cope with this time, what are some of the most useful resources out there for families and children being challenged by the isolation of coronavirus and all of these new technologies?
Yeah, so thankfully there are a few really good resources that can be easily accessed over the internet. One place that I would start and recommend is called the Child Mind Institute, and it's childmindinstitute.org. They're based out of New York, and they have a lot of great free resources all gathered in right on their website for children and families. There's also the National Child Traumatic Stress Network, which is nctsn.org. That also has a lot of fantastic free resources for families navigating this. And then, of course, there's through the Minnesota Department of Health, there's also a number of good resources that families can access there about broader safety, but also specific mental health resources.
Great. And those will be updated on the NAZ blog under our coronavirus resources for future reference.
Great.
From your perspective, what are the most pressing mental health needs in the community that you specifically serve?
Anxiety and trauma. We see very, very high rates of anxiety that might be connected to family stress, community stressors, traumatic experiences. And then we're seeing very, very high rates of children who've experienced either isolated traumatic events or chronic repeated exposures to things like abuse or neglect or community violence. So those are the two most common mental health challenges that we see.
Great. Well, I just want to say thank you for speaking with me today, Tom. For those of you watching, we will link to Washburn's website in the description below this video. And is there anything else that you can think of that people can do, or people can, or any resources that you can think of that would be useful during this time?
Yeah, absolutely. The last two things I would just add is if you go to washburn.org, there are information both about resources, free resources for children and families, but also how to access care. And then I just want to emphasize and encourage, if there are families who are looking for mental health care, we are open, we're available, and we're able to see children and families through the telehealth services that we're providing. And you can just call, we have one central intake number, which is 612-871-1454. We have a whole team of intake specialists who can listen and talk through what's going on and then help figure out what might be the best fit and the best kind of support for your family.
Great. Thank you so much again. That's Tom Steinmetz from Washburn Center for Children, and I'm Danielle Bylund from the Northside Achievement Zone. And thank you so much for watching.